Hey guys, this is Dr. Sandy with another health tip for you and your family. So, one thing I want to talk about today is the concept of health producing and crisis management, which are two complete different categories. Now, when we think of crisis management, that would be using drugs and surgery to stabilize a certain situation. Example being a heart attack, getting in a car accident, maybe if someone's chosen a certain type of cancer treatment, but extreme cases where there may be no other option or what is there to do. And, thank God for those systems. And it could be even something like blood pressure, diabetes, where the numbers are just, out of control or something, and someone is looking for a way to stabilize until they get there. They're using these things. And the thing is, with the medication and surgery, while it definitely helps people get through that crisis, in the background and even at the foreground, I would actually say we should be asking the question like, what are we doing to actually produce health, and what are we doing to manage a crisis? So what may happen is someone may be saying, okay, I'm taking blood pressure medication because the numbers are too high. They've worked with their doctor on that, and while that's fine and they're getting out of that crisis, the question should be asked that on a daily, weekly, monthly, even yearly basis, what are we doing to produce health? Taking the medication may stabilize something, but it's not going to be making the body stronger, healthier. It's doing something to stabilize, but we should be asking the question, what are we doing to make the body stronger? And one thing I want to say right off the bat, some people feel like you have to choose either camp. That's not the case. Obviously, if there's a crisis situation, we need something to get through that. But the question we should always be asking ourselves is, what are we doing to get stronger, get healthier? So part of that would be definitely yes. Obviously, looking at nutrition, we know scientifically nutrition has a huge impact on the body and health. We should be looking obviously at appropriate exercise, looking at the best exercises for the human body, and then obviously also looking at neurology. And if we can look at those things, and then obviously it goes without saying, like the prayer, our relationships, the thoughts we're thinking, all those putting it together, these things can only help the situation. And the vision would be, wow, you get strong enough working with a doctor, and then maybe you can qualify that, slowly getting off, working with your doc, slowly able to get off that medication, and maybe long term completely off the medication if you qualify, or at least on a minimal dosage or something to at least help the situation. I think some people take a medication and that's it. And what I'm saying is that have the dream, working with your doctor, say, hey, everything is awesome. I got out of that crisis. I'm able to get off this stuff. Maybe stage two is that, well, I'm not exactly where I should be, but at least I've minimized it. And even if you're on something and the doctor says, hey, just where you're at, you have so many health issues, you can just take that. What's wrong with having better diet, exercise, having better neurology? It only helps the situation. And maybe the goal should be, okay, fine, I'm on BP medication. I'm going to take care of myself. And I want to make sure that I don't end up on something for diabetes, my cholesterol, my other systems. I want good focus. I want good memory. So having an objective to say, man, the dream over my lifetime is to avoid medication. If I'm on something to a minimal amount and definitely want to avoid surgery, what are things I could be doing daily, weekly, monthly, yearly? What are things I'm doing to get better, stronger every year that I'm alive? And that's the vision for our office. That's the vision for our patients. So those are the two categories. So one is crisis management, one is health producing. Health producing is for the whole population. We should always be getting stronger. Crisis management, as we said, extreme situations we need it, but I don't care if you're sick or well, you should focus on health producing. You need to do health producing. You should be getting healthier and stronger. You'll have a better life for you and your family. Thank you. God bless.